The Health CEC for allegedly snubbing today's invite to respond to the emerging issues that have crippled Kisumu's health sector for the past 3 months. The CEC assumed office after a predecessor was sacked over incompetence, had sent representatives who, according to the word representatives, failed to give satisfactory answers on the matter of payment of the health workers. We are now joined by Laura Otieno from Kisumu. Laura, good afternoon. Now, after snubbing those summons, what will happen to the CEC? Has she been summoned yet, and what is the state of the health sector? Have workers resumed after signing a return to work deal?
Well, indeed, Randy, the CEC, according to the resolve by the Health Committee, will be summoned next week to come and answer very pertinent questions that had seen the Kisumu health sector thrown into total paralysis for about 90 days. So far, health workers resumed work yesterday after signing a return to work formula with the county government. But then they were very categorical today in their presentation before the committee, saying that they have only suspended the strike and they will be downing their tools once again on December 31st should the county government fail to meet the parameters which were agreed upon when the two were signing the return to work formula 2 days ago at the county government offices. So, of course, we have seen among the various presentations made at the floor of the House today, there was a sort of ping-pong game between the executive and the legislature, because the health CEC, in as much as she had failed to appear before the committee, she had sent various representatives in her department who were accusing the legislature, or rather they were accusing the budgetary process, indicating that they had not been given enough money to enable them run various processes within the health sector. But then we saw the legislature throwing the ball back at them, indicating that the budget had already been passed and pertinent issues on matters of, especially concerning matters of payment of nurses, doctors, and the entire health workforce should not have come into play. So, of course, we will be waiting to see next week what the parameters will be, because today the CFO has indicated that as far as the health department of the county government of Kisumu is concerned, health workers were already paid, they had received their payments, and therefore confirming what the governor had been reiterating for the past few months, indicating that he does not really understand why health workers of Kisumu County have been on strike. So far, normalcy has sort of occurred again at the public health facilities across the county, but then we are waiting to see whether residents are confident enough in terms of going to seek services at those particular facilities, because remember, Kisumu County, as one of the counties that was piloting UHC, had really faced a big blow concerning the strike paralysis, or rather the paralysis that had hit Kisumu health sector for about 3 months. So, of course, tomorrow perhaps we will be moving around hospitals to see whether the services have picked up completely, or whether some people are still shunning those public hospitals, because some of the issues also the union workers from the health workforce indicated was that they were very demoralized in terms of harsh working conditions within the hospitals. So, of course, we will be keeping a spot check on whether normalcy has returned in the health sector, even as we wait for the official summoning of the health CEC, Professor Judith Megura, by the Health Committee of Kisumu County, Randy.